Hello, my name is Joan Meyer. The Bridges to Health Home and Community-Based Waiver Program, also known as B2H, is designed to support children in their homes and communities. In this video, we're exploring the details of the Bridges to Health program. The video features an introduction and 6 chapters. The information contained in these video presentations is available in the B2H Program Manual, which is located on the B2H website. In this chapter, Chapter 1, we're going to review eligibility criteria for the Bridges to Health program. Children who are referred to the B2H program must meet all of the following criteria. They must be in the custody of a local Department of Social Services Commissioner or in the custody of the Office of Children and Family Services Commissioner in the Division of Juvenile Justice and Opportunities for Youth. They must be Medicaid eligible. Remember, all children in foster care are Medicaid eligible except those without proper documentation of immigration status. They must have an appropriate and documented qualifying diagnosis of serious emotional disturbance, or SED, for example, PTSD or conduct disorders, a developmental disability, or DD, for example, mental retardation or autism spectrum disorder, or medical fragility, or MED-F, for example, a child who is vent dependent or has a neurological disorder associated with fetal alcohol spectrum disorder. They must be eligible for admission to a medical institution and assessed to meet the level of care criteria for one of the waivers in the B2H waiver program as determined by the Healthcare Integration Agency. They must be willing to enroll in the B2H waiver program and live in an environment where caregivers are willing to cooperate and support the child. A residence of 12 beds or less is considered a qualified setting for receiving B2H waiver services. They must be able to benefit from services offered through the B2H waiver program. They must be able to be cared for in the community if provided access to B2H waiver services. Children enrolled in B2H must meet certain age requirements. In the case of a child with a serious emotional disturbance, at enrollment, a child must be under 19 years of age. If other criteria are met, services may continue until age 21, regardless of foster care status. In the case of a child with a developmental disability or a child who is medically fragile, at enrollment, a child must be under 21 years of age. If other criteria are met, services may continue until age 21, regardless of foster care status. For all children, once enrolled in B2H services, a child may continue to receive services even after discharge from foster care until age 21, as long as they are otherwise eligible. There are also administrative requirements for enrollment. The Healthcare Integrator, or HCI, must complete an application for enrollment on behalf of a child. Included in the packet is the Individualized Health Plan. The Individualized Health Plan describes the B2H services that support the child's health and welfare. The local Department of Social Services, ACS, or DJ Joy must then authorize the application for enrollment packet. Finally, B2H is a voluntary program which cannot be mandated. Participants have the right to choose whether or not they want to participate in B2H, the services they receive, and who provides them. Freedom of choice is the hallmark of B2H. That brings us to the end of Chapter 1, Eligibility Criteria for the Bridges to Health program. In Chapter 2, we'll review benefits to the child and family.